Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The U.S. Centers for Disease Control and Prevention released a statement last week with the assurance it is investigating a nationwide outbreak of Cyclosporiasis. But the network that would have once provided data on the outbreak was scaled back last year by H.R. 1, or the One Big Beautiful Bill. Cyclosporiasis is an intestinal infection caused by a unicellular parasite that can contaminate food or water, most closely linked to fresh produce. Partially due to the rollback of public health funding, much is unknown about the origins or even what food items are most likely carrying the parasite. Foodborne Disease Active Surveillance Network, or FoodNet, previously surveilled, tested, and detected Cyclospora, but now its work is cut short, putting the country's food safety network at risk. On to the damage report. In 2026, the national healthcare industry has seen 17 maternity service closures, adding on to 29 closures from 2025. Most recent closure announcements include labor and delivery at North Star Health Alliance in New York, CHI Health Mercy Council Bluffs in Iowa, Brattleboro Memorial Hospital in Vermont, and Ohio Health. Consistent with the majority of maternity care closures we've seen this year and last, hospitals cited increased cost, low reimbursement, and staffing challenges as the causes of closure. And now for today's success story. The Navajo Nation Reservation, located across rural Arizona, New Mexico, and Utah, is home to many veterans. Access to care often requires hours of travel time. The VA Mission Act program is bridging the extensive gap in care by partnering with academic programs, hospitals, and clinics to bring healthcare directly to veterans. So far, the program has served veterans and non-veterans living on the reservation, allowing access to preventative care, medication management, and personalized attention within their community. This is a great example of innovation at work in rural health. Thank you to our sources for this episode: CDC, the American Medical Association, the Washington Post, Becker's Hospital Review, and VA News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.